The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon, everybody. Welcome back to our Retention Planning and Strategy series, focusing on behavioral health providers. My name is Suzanne Spear. I'm the Director of Workforce Development here at ACU, and we're excited to have you with us today for the second of our three parts of the strategy section of our Retention Planning and Strategies Learning Collaborative today. And just a couple things as we go along here, just some webinar housekeeping items. So we are recording this webinar. Just keep that in mind as we go along. The recording and also the slides from this webinar today will be posted on the discussion board. So if you'd like to go back and reference anything that was talked about today, you can go and do that there. Feel free to ask questions as we go along, and we are going to have some fun today, I promise you. If you do have any questions today as we go along, feel free to raise your hand and also use the chat and questions boxes. We will monitor those as we go along, and then after our presentation today, we will launch into some time for some question and answer period at the end. If you have any if you have any problems today with your connection, feel free to email Mariah Blake, our program manager at mblake@clinicians.org. So she is there and ready to answer any technical questions you might have. So we are excited to once again, for this part of our series, have a guest presenter talking about EHR strategies that you can employ to reduce burnout with your behavioral health providers in your organization. Her name is Natalie Truesdell, and she is the Technical Assistance Lead at the High Tech Center at John Snow, Inc. And Natalie has been she's been working with health centers for over 10 years, and she specifically focuses on the areas of needs assessment, strategic planning, quality improvement, evaluation, and performance measurement. So we're just really excited to have her with us today and can't wait to hear all the great things that she's going to talk to us today about with EHR and provider burnout as it relates to integrated care teams and behavioral health providers. So without further ado, I will let her take it over. Thanks so much, Natalie.
Thanks, Suzanne. So I'm here today, as Suzanne said, from the High Tech Center. And the High Tech Center, you may be aware of, it's another national cooperative agreement similar to STAR² and our focus is supporting health centers with their use of the EHR to support data-driven quality improvement. We provide support in a number of ways. We have an extensive resource and knowledge base at the hightechcenter.org. We have a number of workshops and webinars we do similar to this. And we provide targeted technical assistance. And so it's really our pleasure to collaborate with our partners at STAR² today to talk a little bit about the topic of health IT and as it relates to burnout and very specifically for behavioral health providers. So one of the things that we focus on at the High Tech Center is just thinking about how we optimize workflow and use of EHRs for providers. And HRSA, in funding the High Tech Center, is really going to encourage health centers to think about how they can utilize EHRs to the best of their ability to really support quality care. So we know that there's some very positive things about EHRs, and then there's some things that are not so positive. And for this webinar, what I'm going to start out by talking about is first the positive, just some of the highlights in terms of what providers think are good about using their EHRs. And then I'm going to talk a little bit about what is known about contributing to dissatisfaction with EHRs and how that relates to provider burnout. And very specifically what that means in the world of behavioral health that's different for medical providers. And then finally, I'm going to talk a little bit about some good amount of time on the solution side of things. It's not all negative news. There actually are things you can do to address the challenges that providers have in using their EHRs. So here to start, here's some of the things that we know providers, and this is providers generally, not just behavioral health providers, find really beneficial from using an electronic health record versus the old paper record. And those are things like the ability to do e-prescribing, the fact that they can access patient information, if you have good relationships and IT support setups with your local hospital, emergency room information, that kind of thing through a health information exchange. You have information at your fingertips you might never have had before in the old days of the paper records. You also have the ability to share data much more easily with other providers, including labs and record results to check for drugs and allergy complications for your patients, and then also the ability to incorporate clinical lab results. So those are some of the positives that providers talk about when they talk about the transition to using an EHR. One of the things that has been extensively documented as well is not just the benefits, but the challenges that contribute to provider burnout. The use of an EHR is a really major change for clinicians and their workflow, and the systems, very honestly, are not always easy to use. And so providers kind of talk about how the EHR is actually contributing to their feeling of poor work-life balance, their inability to interact with patients in the same way, so patient satisfaction, their time with their patients, and their patient visits. And we know that the EHR can also contribute to more documentation time, and contributing as much as 2 hours of documentation time in EHR or desk time for every hour of patient care. And this is a real issue. It definitely contributes to the burnout rate we're seeing across providers and turnover and attrition. I recently read an article talking about provider burnout that I think shows how we really need to pay attention to these. And I'm sure this has been talked about in your prior sessions, but it was providing the analogy of how when we think about our professional athletes, we think so thoughtfully about their meals, their training schedules, their sleeping patterns, transportation, and all the tools that support them in doing the work they do to do the best work they can. And we make sure they're at their best on game day. When we think about our providers, our both behavioral health clinicians and our physicians, I don't think they feel like they're quite as supported as well. And that health IT is a big component of the supports that could be there for them that's just not quite there for folks. And instead of being the support that they need to do their optimal work, can sometimes be a real challenge for that. And especially just knowing the burden it puts on people to know they have all this documentation work that might happen after their clinical time is a challenge. So those are some of the things that I'm sure you're familiar with, hearing some of these challenges with EHRs and provider burnout. So, and I think, again, you guys have probably seen or heard about the costs related to recruitment and retention. So I'm going to gloss over that slide. There are real cost elements to the provider burnout contributed by EHR. So given all that, it is important to really listen to the provider concerns. And I pull up these quotes as some very specific examples of the kinds of challenges that providers talk about, and getting into the detail of at the end of the day, what they're frustrated by. So there are things like the concern, as I mentioned before, their interaction with the patient, that it's of lesser quality than it might have been without an electronic health record. There's also just frustrations as we update our health IT systems. The streamlining of those updating processes is a challenge. So the second quote is from a provider who says they've had to use 2 EHRs simultaneously because they didn't migrate all the data. And then on top of that, they've been told that the new data will all be in the new system for every day for months, but each additional day is a strain on that provider. So this is just kind of highlights the point that if you are migrating systems to the extent you can, number one, keeping providers informed about what that transition will look like and being realistic about it, but also doing all that you can to ensure that that process is streamlined so their providers are not working on multiple systems at the same time. That's incredibly challenging. And the other thing that people talk about quite a bit is just the frustration in finding things in their record, hunting down specific information that they need for a patient while they're in the room with the patient can really add time to the visit and be a concern. So this is just some of the highlights of the types of concerns that providers talk about. Oops, like I advanced a little too far here, so I can go back. Suzanne, if you're able to take me back a slide, for some reason it's a revolving door here for me. Thank you. So one question I wanted to ask the group, just to understand of those that are on the call, where you guys are at with your behavioral health documentation specifically, and then I'm going to talk about the world of behavioral health EHRs, is just to understand among those on the call how behavioral health providers are documenting their visits currently in your clinic. And the options are, the first one is that you have a shared EHR between behavioral health and medical providers, so a single record that's electronic for all providers. The second is you have a behavioral health record that is distinct and separate from a medical EHR. And then the third option is that you have both providers combine both a medical and a behavioral health record, and that may be electronic or paper, so they're really using two systems simultaneously. We'll give a pause there to see if any of the participants can share what their current setup is for documentation.
All right, and for everybody on the line, your poll question should have popped up on your screens there. If you could just take a second and pick one of those options that best fits your health center and let us know. All right, and it looks like a resounding option C for both.
Okay. Well, that is not too much of a surprise, as one of the things I've been working with health centers for some time is integrated behavioral health, and it's quite common that people have to use two systems. And I'm going to talk a little bit more about why that's often the case based on what's available for behavioral health records here in a moment. But if we could go to the next poll, I have one more question for folks. Let's see here. Suzanne, there you go. Thank you. So one of the advantages when we talk about integrated behavioral health is the opportunity for real collaborative care across providers. And what that means is yet another shift, not only the electronic piece, but thinking about how do you document together as providers and develop. Often the gold standard is to have a shared care plan for your patients that integrates goals both from a medical and a behavioral health perspective. And because this is kind of the unicorn everyone's looking for, I'm curious to find out across the group here as well where people are with that, because it's what I hear from folks, often something they're working on and are challenged by. So the first option here is we do not currently have shared care plans. The second option is we document a care plan on paper. The third option is we have an electronic shared care plan in the EHR, but we don't use it. The fourth is we have an electronic plan that's used by some teams, but not all of our teams. And then the fifth option is we have clear documentation protocols and processes and a shared care plan that's used by all teams. So we'll pause here to get some information from the group.
All right, and it looks like, again, a resounding response. Shared electronic care plan is used by some teams, but not all.
Great, thanks, Mariah. Thanks again for everyone for sharing that. And the reason I bring that up is, as I pointed out, developing a protocol or a process for your shared care plan can really help alleviate some of the stress and confusion that goes into this new way of doing our work. And that's often a stumbling point for people. And I'm actually kind of surprised that no one responded. They have one in their EHR, but they don't use it at all, because I've heard that often when I've been talking to health centers in the field. People are so kind of overwhelmed with the concept of even how they go about using it, that it just kind of sits on the shelf there, and it's often not used. But the other scenario, which a lot of you are in, is that there's some teams that really take it up and embrace it, and then there's others that are kind of finding their way on how that could be done across their team. So thank you. All right, so next slide. We're going to talk a little more about the experience of behavioral health providers with EHR specifically. So one of the challenges is that from the research, we know that behavioral providers are, if it's possible, even less satisfied with their EHRs than medical providers. And there's a few reasons for that. One of the big ones is that the services that behavioral health providers provide, and this is not just in an integrated primary care setting, but obviously in outpatient and hospital settings too, is so varied that the vendors have struggled to really develop a product that meets the various needs of behavioral health providers. And they, as a result, each product doesn't feel like it's meeting the needs of any one provider, and behavioral providers are often dissatisfied with what they have. The other challenge is that that once even you've acquired a behavioral health EHR, typically for mental health providers, most organizations stay with their current EHR for two reasons. One is lack of resources. It's expensive to make the switch. And the second big reason is that they can't find a viable alternative that is more satisfactory than what they have. And I had the experience of working, or I have been working with an organization for about 3 years now that was in a place where they'd actually gotten a grant funding from Robert Wood Johnson Foundation to look at their shared care plan, got additional $100,000, did all the research to identify the vendor product that would support that, and then just stalled getting a new EHR completely, because they just realized that what they were going to get was not going to be any improvement on what they had in place already, and was only going to add additional resource constraints. So I think the reality is, for behavioral health, the vendors are still working to really develop a product that fits the needs of behavioral health providers. So it's a real challenge. So that's not to say there's nothing to be done. And I kind of shared a lot of potentially disheartening information about EHRs and behavioral health specifically, but there are things that can be done to improve care and provider satisfaction at the same time with the EHR. So what's important is focus on two key questions. And one is to think really about the workflow design, and how talking to your providers about how workflow and the EHR work together, and how those come together to streamline the patient visit and reduce burnout. And then to look at very specific components within the current record you have that might be addressed to lower stress, and take it piece by piece. One of a recent study by the American Health Informatics Association was a broad group of providers found that just taking that extra time to explain the functionality and the utilities of the EHR to the behavioral health clinicians really helped providers to understand how that record could add value to their current practice. And so it's related to kind of the onboarding piece and thinking about having that customized for your behavioral health provider specifically. And once you do that, clinicians are much more likely to express positive attitudes towards the technology once they understand how it can enhance their workflow process without being a barrier to their patient-provider relationship. So I'm going to go to the next slide here, and here's some pretty comprehensive list of some of the solutions that are out there that are not about just buying a new EHR, which likely is not going to solve all your problems. So there's kind of three categories of potential things to work on that would support your behavioral health providers and really all your providers to think about. So there's solutions that relate to kind of the interface with the EHR, there's process solutions, and then personnel solutions. So I'm going to talk about a few examples in each of these. So on the interface side of things, one of the frustrations we hear is, and you guys pointed out, is if you have multiple systems, just switching between systems can be a barrier. So looking at how you can implement a single sign-on so that providers, when they are in the system, they're actually in all the systems they need to access, which will allow for quicker switching. And then to just think about those other access points, whether it's other ancillary applications that providers need to access, and streamline to the extent possible the access to those. And then finally is to just continue to work with providers on the templates and not assume that the standard package template is going to be the right one for your providers, and to give them a voice in working with you to make changes to those templates. The second category of potential improvements is on the process side, and this is really kind of just acknowledging and having a conversation with providers about ways that process is going to be improved. So a very structured way to do this is to implement a vendor scorecard on patient-provider interaction time and after-hours documentation time, and really start to document and analyze what is the reality for your providers in terms of what they're spending after hours and documenting, and set goals to work to reduce that across your providers. Some of the other things are to actually take the time to align your documentation requirements and actual end user entry. So that's acknowledging that there's a lot of data entry and really focusing on what's the priority for providers, so that where you really want standardization, everyone's clear and consistent on that. And then the simple things of just having a regular meeting that talks about how we optimize our process and using our EHR, and having a forum for people to voice their concerns and ideas, and to really gather those ideas from a variety of team members. On the personnel side, and this happens more often on the medical side than the behavioral health side, but there are opportunities to think about delegation of tasks across the team that might support easier functionality of the EHR. And it can also be things like how messages are routed across the team, and considering if there's ways to prioritize that and triage some messages to other providers that would support the inbox management for the providers you have. So this is a long list of some different ideas, and you can't take them all on at once. So an easy first place to start and trying to decide where you might focus your improvements. Again, let me just back up here. Is to talk to your providers and ask them really what matters to you. Many of you probably have seen the IHI framework for improving joy in the workplace. And that kind of framework applies here too in terms of addressing burnout and EHRs. I think the easy thing to do is say, well, we just need a new system. We need a better system. It's our EHR that's the problem. But as I've pointed out through some of my previous slides, the challenge is there is no perfect system. And so when you're faced with that, it's kind of turning away from the technology solution to look more at the process solution and the pieces that you may be able to make some changes around the margins that seem small but could have a big impact on the daily workflow for your providers. So engaging them in a conversation and asking them, what are your frustration points? And what are you most challenged by? What's taking you the most time that's a frustration for you, and doing your documentation. That can be a starting point to just identify a few places where you can make some improvements. And the literature, and I think all of our common experiences, is that once providers see that you're committed to making some small changes and they see the results of that, that does a lot. Even if you haven't solved all of the challenges with the EHR, you've continued to do some improvements, and that really can support providers in feeling like there is a path forward to having an EHR that meets their needs. So in terms of a starting place, I do want to ask all of you whether you have some initial ideas based on what I've said here, and also maybe what you've been thinking about already in talking to your teams, of where you might start to improve your EHR for your providers. And so it's no longer just a big headache every time they walk in the door and log in, but how can you streamline that tool so it's a support rather than a hindrance to their work? So here's just some initial steps, and you might consider. I'd like to get the group's thoughts on where you might prioritize your first step. So the first one is asking providers what really matters. The second one is developing a workflow map of documentation in their EHR, understanding where providers are putting different types of information, and if you have a shared care plan, who's putting what in where and when. The third is developing a team to address the health IT concerns of your behavioral health clinicians. And the fourth is doing that outreach to your EHR vendor to support you on customization of a template or something else that your team's identified as a problem.
All right, and we're going to leave this poll question open for just a little bit longer. I notice we might have some PCA folks on the line. So if whether it's you at the health center level or you up at the PCA level, what would be your first step? Or what would you recommend to the teams that you're working with as a first step? If you could go ahead and make that selection on our poll, I'll leave it open for just a few more seconds to get some feedback in. All right, and it looks like we've gone 50-50 with asking providers what matters to you and developing a team to address HIT concerns of behavioral health clinicians.
Great. Well, those are both good steps. And I like that the group chose those rather than first going to contacting an EHR vendor. I think the first step is really just to prioritize what it is that you want to work on. So those are great first steps. So I want to, we're going to have some time for some additional questions and discussion and additional thinking. I think at this point we can take questions either on the chat, and it's a small group, so probably on the line as well.
Sure thing. Well, we can just start. Both the chat and the questions box are available to everybody in the right-hand side of your screen in your GoToWebinar controls. We could also unmute the lines so that folks could chime in. I just want to give you a bit of warning. Any background noise happening in your office will be picked up and broadcast on here. So if you feel like you have background noise that you don't want going all over the place, just go ahead and mute yourself once I've unmuted you. All right, and all of the attendee lines should be open and ready if anybody wants to chime in with a question.
Hi, Natalie. That question came in. How do you bridge the gap between your behavioral health provider staff, the needs of your behavioral health provider staff, and the rest of the providers that you have at your health center? As relates to EHR, if you don't have money for a different system.
So I notice there's kind of two pieces I often hear people talk about there. One is to start is when we're bringing behavioral health providers into a medical setting is just having a conversation about the documentation expectations and what everyone would find helpful, both on the behavioral health provider side as well as the medical provider side, because the training is so different in terms of documentation. And so that's kind of the first stage, is just understanding what information and in what format and the length and all of that, and where in your EHR you'd like the behavioral health provider to be documenting. If you don't have a behavioral health specific EHR, there likely are places where you can have notes and free text. And so it's having a conversation across the team in terms of if the behavioral health provider is going to add a note that they want the medical provider to see, where would that be? If they want to add a note that they want really only for their own purposes and does not need to or shouldn't be viewed by the provider, where would that be? It's often just a workaround due to what EHR you have. There's not a single solution. One resource that I can offer to Suzanne to distribute is the class standards, which really does objective research on behavioral health EHR records as well as other medical EHR records, has done some recent research looking objectively at the various behavioral health EHRs that are currently available that can give some folks some guidance if you're in the position of looking to purchase a behavioral health specific EHR. And so that might be a resource in terms of if you were thinking to move forward to actually add a system. But in the absence of having a behavioral health record, it's looking at the options within the system you have and sitting providers down together to make joint decisions on where things would be placed is really the best solution I've heard from folks I've worked with.
That's great. Thank you so much. And we will be happy to distribute that to all of the folks on the line today.
Great.
Any other questions? Well, if you think of anything, feel free to put it in on the discussion board after this today, and we can make sure that we get those to Natalie for some answers there. And I know this is a really big topic and affects folks in a lot of different ways, and can feel a little daunting there. If you, like I said, if you have a question that comes up after this, if you go back to your team and say, hey, how do you think about this or whatever, feel free to go ahead and put that on the discussion board, and we will get Natalie to answer those questions that way.
Yeah, absolutely. And, on that point, the High Tech Center has been expanding our resources as it relates to health IT and behavioral health for fairly obvious reasons. All directions are pointing to providers and specifically health centers doing more behavioral health. And we absolutely would be willing to answer any specific questions that folks have. And if there are things that you were hoping to hear on the webinar today that I did not cover that you really would like more information on, absolutely put that on the discussion board. If we don't have it, we can do our best to see if there's a resource out there currently that would address your questions. And if not, it's helpful to us as we develop our additional resources going forward. High Tech Center, because it's a ever-changing field in health IT for health centers. If there's not a good resource for health centers, often we have some flexibility to help develop one. So whether it's a case study or a tool or whatever. And in that spirit of, more focus on this topic, I just wanted to make people aware of 2 webinars that we'll be hosting at High Tech Center early in 2019. So on January 17th, we're going to have a webinar that's focused on the use of health IT and STAR², so screening, brief intervention, referral, and treatment, and thinking about that workflow and how health IT supports that. And then the date hasn't been set, but we are planning a second webinar that's really focused on how health IT can support the expansion of opioid disorder treatment services in health centers. So mark your calendars or stay tuned for more information on that. And how to register is you go to hightechcenter.org. We have a place to register for our upcoming webinars. So, and just a fair warning, I don't know the registration's up yet for the January webinar, but it should be next week.
So Natalie, we will make sure that we get all the information from you guys about these 2 webinars. And in our upcoming newsletters, we'll make sure that we have all of that information in there so folks can sign up as well.
Perfect. Great. And then I know you'll probably post this slide deck as a resource, but we've got a number of references from the content we provided today, if that's helpful. But again, we are happy to track down other resources if folks have questions.
Great. Any more that have come in? All right. Well, thank you guys so much for joining us today again. And we do have one question on the discussion board. So log into that and engage and, just make the best use out of this learning collaborative here. And go ahead and do that. And then our next webinar, the final in our series, is going to be next Wednesday, December 12th at 3 p.m. Eastern. And CHC Inc. will be here talking about the role of team-based care and how that can increase retention at your health centers. So thanks again, Natalie, and we appreciate all your great insights and this really important and ever-changing topic. And we will talk to everyone soon. Thanks so much, everybody.